Hello everyone, my name is Dr. Babatunde Okewale. We'll be talking about endometriosis today. Before I explain what endometriosis is, let me tell you what the endometrial lining or tissue actually is. The endometrium is that part of the uterus that is lining the inside of the womb, and it is that part of the uterus where a woman menstruates every month. What happens in every menstrual cycle is the endometrium starts growing, it grows thicker in expectation that a pregnancy will come and implant inside of it. And if no pregnancy occurs at the end of the month, it sheds itself and comes out from the vagina as menstrual flow. Now, sometimes those endometrial tissues are found in other places apart from inside the womb. Sometimes they are found on the ovaries, sometimes they are found in the rectum, sometimes they are found in the vagina, sometimes they are found in the fallopian tubes, sometimes in the urinary tract, and they have been found in far-flung places as far as the lung of a woman. And the question is, how did the endometrial lining get into those places? So anytime you see the endometrial lining or the endometrial tissue in any other place apart from the inside of the womb, we call that endometriosis. They are ectopic endometrial tissue in places where they should not be. Now, the reason why they are dangerous is this. The endometrium is under the influence of an hormone or many hormones, and that is why it can grow in the early stages of the menstrual cycle, and if pregnancy does not occur, it sheds itself. In the same way, the hormones that control the endometrium control those ectopic endometriums, which we call endometriosis. So every time the endometrium is being shed inside the womb, those endometrial tissues that are ectopic to the inside of the womb, they grow and they shed blood as well. But the difference is, for the one inside the womb, there's an outlet. The blood flows out through the vagina every menstrual cycle. But these ectopic ones that we call endometriosis, they have no outlet. If they are on the ovary, they will grow, they will shed blood inside the ovary, and what do they form? They form a cyst, endometriotic cyst. If they are in the rectum, or in the vagina, or even in the lung, they would grow, just like the normal endometrium will grow, and then they will shed their blood, and there is no outlet. So in the process, what they do is, because they grow and they shed this blood, they form scar tissues, they form adhesions, they form patches, and they form cysts, which could lead to severe pain, and in women who are trying to get pregnant, infertility. In fact, it's been estimated that about 50% of women who have endometriosis suffer from infertility. So what causes endometriosis? How do this ectopic endometrium get to those areas? The bad news is we don't know in the majority of cases. But it's been postulated that there is a situation called retrograde menstruation that causes endometriosis. What do we mean by retrograde menstruation? Normally, when the endometrium sheds itself, it's supposed to come out directly through the vagina, through the cervix, and through the vagina into the outside. But sometimes those blood, they flow backwards. They flow backwards through the tubes that open into the abdomen or the pelvis and shed blood in there. And in the process, some of the endometrial tissue are deposited. Rather than being deposited outside, they are deposited inside the woman. And from there, they are carried to other areas of the internal portion of the woman. And so that's how it gets to the ovary. That's how it gets to the fallopian tube. And even sometimes how it gets to the umbilicus. So that's the theory. Another theory is that this endometrial lining are carried through lymphatic channels that we do not know, or through blood vessels into those far-flung areas. The truth of the matter is, we don't totally know how it happens, but we know that retrograde menstruation is one of the ways. What are the symptoms of someone who has endometriosis? For a woman, one of the commonest symptoms we see when they come to the clinic is the complaint of infertility, the complaint of painful intercourse, the complaint of painful period, and some might complain of other symptoms that arise from where the endometriosis is. For example, if the endometriosis has formed cyst on the ovary, they might complain of pelvic pain. If the endometriosis has deposited bloods in the lung, the woman might complain of what we call hemoptysis every month. That is, when she coughs, she sees blood in her sputum every month, and it follows her menstrual cycle. There are some women, every time they are bleeding every month, having their menstruation, they bleed from the umbilicus, which shows that there are endometriotic spots in those areas as well. Now, how do you treat endometriosis? Or how do you diagnose it? The mainstay of diagnosis for endometriosis is laparoscopy. What do I mean by laparoscopy? Laparoscope is an instrument that you use, is a telescope that you use to look directly inside the womb, inside the tummy of a woman. So you would have a direct view. If the endometriosis is on the ovary, you can't see it directly. If it's in the pelvic region, you would see it. If it is attached to the rectum, you would see it. So the best way to diagnose endometriosis is by direct view. And the best direct view is through a laparoscopy, or sometimes through a laparotomy. You can be doing an operation for something else inside the woman's stomach. Maybe you are doing a cesarean section, or you are doing a fibroid operation, and then you notice the endometriotic spots. So the diagnosis is very dependent on direct view. And that was one of the reasons why it is being underreported in countries where laparoscopy is widely done. If a woman comes and complains of pelvic pain, complains of painful intercourse, complains of painful period, the first thing that comes to your mind is, maybe she has pelvic infection. But it was when we started doing a lot of more and more laparoscopy that we found out that the incidence is high. Endometriosis also causes tuber blockage, and that is why sometimes it presents as infertility. How do you treat endometriosis? Most of the time, you have to either remove the endometriotic spots, either by burning them off or cutting them off, or if it is a cyst, removing them. And most of these procedures can be done through a laparoscopy again. Sometimes you might give drugs to try and quieten down the endometriosis. Using drugs, whether it's injection or hormones, is not a permanent solution, but it can give tremendous relief. And in quite a sizable number of women that you place on those drugs that blocks the hormone that makes endometriosis grow, they find a lot of relief. But there's a problem there. If you block those hormones, they will block the hormone that results in pregnancy. So for a lot of women that have endometriosis, it is not an option for them because they are also still trying to get pregnant. And in such women, you might have to do a laparoscopy to remove the endometriotic spot, to ablate it by burning it, or to relieve adhesions that has been formed. Another method of treating endometriosis, especially for women who are trying to get pregnant, is by assisted reproductive techniques, that is IVF. In mild endometriosis, IVF has been found to be especially useful. Quite a lot of women who had infertility and endometriosis have been helped with the use of in vitro fertilization. To know more about endometriosis, I want you to go and read my book called How to Get Pregnant and Have a Baby. It is available at Amazon, and you can also request for it from our website at www.stiveteshealthcare.com. Thank you for listening to this short talk on endometriosis. I would like if you will subscribe to our YouTube, if you would like, and also share this message. Thank you.